and hopefully take any questions from anybody. So this is the team, and as I mentioned, One Medical Group and QAD have done a number of medical centres and primary care centres together before, but everyone, and this is the reason for showing this slide, is different. And the reason for that is that we very much like to design bespoke buildings that are relevant to their particular circumstances and to their users. So how did we get here? So the image on the top left-hand corner is an aerial view of what is currently at the heart of Aspull at the moment. And having our first port of call as architects is to look at the site and to look at the context, and then to try and take cues as to where we might be able to evolve the design in response to that immediate context. So again, going back to what I was just saying about every building being bespoke, it also is bespoke in relation to a response to its particular environment. So having done that, the centre top image is our analysis diagram. I just think it's useful, hopefully, to explain to you our method of working. Designs don't just come out of thin air, they are sort of born of lots of different aspects, and this is just explaining a little bit of the process. So things that we're considering in that diagram, sorry, I don't expect anybody to be able to read that, it's just by way of illustrating the means of working. It's things such as the orientation of the site, the routes through and around the sites, pedestrian routes, vehicular routes, how the site is connected to residential areas in and around it, how people move from those areas to other areas, etc. So that come into the mix to assist the process. Other things that had an influence on the design were particularly pertinent to where we are at these very unfortunate times with a worldwide pandemic. What that's done in a positive way for the NHS is that plans that were already afoot and have been talked about for a few years now, it's hastened the advancement of those plans. And a key one of those is the whole notion of primary care and how that is used, and the idea of using technology much more in primary care. So rather than the traditional method of everybody pitching up at the doctors and then going to see a doctor and then walking out having seen that clinician and having been treated or consulted, the new way of working that's been brought much more to the fore is methods of digital triage, and by that I mean telephone consultation, video consultation, etc., before anybody sees the patient face to face. So the diagram on the bottom left is a concept bubble diagram that we drew very early on in the project to explain back to our clients how we interpreted those spaces to work and how that might influence the overall shape of the primary care centre. Then the bottom middle diagram is one of the very first iterations of the massing of the building on this particular site. So this was done effectively to test a scheduled accommodation, which you see listed on the right, in terms of key rooms, numbers of car parking spaces and other key criteria, and to see if that would actually work on this site. I don't know if you all know, but the site is an amalgamation of the Aspull surgery and the Aspull clinic that's currently there at the moment. So this is a blow up of that site analysis diagram, and you can see the two buildings in the centre there that will be demolished. The way in which we see the programme working is that the Aspull clinic will be demolished first as part of the enabling works, and that will allow us to build the new primary care centre over that half of the site. Once that is complete, the Aspull surgery will be demolished and the car park will then be constructed. So the idea being that the Aspull surgery can continue their operations throughout the entire first part of the build. The clinic isn't fully utilised at the moment, and the rooms that are operational within that space will be spread elsewhere around the borough and then brought back into the new building once that's completed. So the diagram that you see in front of you now is a site plan of our proposal. So the idea is that the new primary care centre sits to the southern edge of the site boundary, facing directly onto the green. And we're very keen that one of the things that we found in our site analysis was that the movement in and around this site is very much dominated by people moving by foot, or people pushing prams, or people in wheelchairs. And so we were keen that our development shouldn't hinder that process. It should actually enhance that if at all possible. So one thing that we've talked about in quite a great length of amount of detail with the planners is creating an access route through from the green directly through underneath our building into the area behind the shops that are there at the moment, and then looking at the car parking and everything else that's behind that the new building and behind the shops, and seeing if we can enhance all of that. It's a very well used route. People generally come from the residential estate here and circulate up onto Hague Road. People come across the green, etc. So one of our first thoughts was that this could do with enhancing. Fortunately, when we started speaking with the planners, they were in agreement, and so even though part of the car park is outside of our site, they were keen that we look to try and evolve that as part of the overall development to enhance the overall setting. So just to almost summarise where we we're going in terms of the objectives, is that this building shouldn't just be another doctor's surgery, a typical primary care centre. It should be looking to the future and looking to how the NHS is looking to not just treat patients, but to positively engage with society. And by that, what I mean is that the old sort of thought process was that the lesser the engagement with patients was almost the better, because that costs least amount of money, whereas the way of thinking now is the more engagement the better, because that enables positive interactions with public. I'm not going to call them patients, because not everybody is a patient. It's about empowerment and about giving knowledge to people. And so the idea is you might visit this building not because you are unwell, you might visit this building because you want to gain information about health. And that's really at the forefront in terms of the way in which we're thinking. And that sort of thought process has been something that we've been keen to engage with all stakeholders, including yourselves, in terms of how we can challenge ourselves to make this building even better and how it can help deliver more services better going forward. So the two diagrams in front of you now, on the left hand side is the ground floor plan of the building. So on the right hand side would be where the green is, and this is where we punch underneath the building. The building will have a pharmacy sitting alongside the primary care centre, and then the main entrance is over on this side, coming directly in off Hague Road, but obviously you can get access down the side in there as well. The facilities on the ground floor include 7 consulting suites that will be used predominantly by, or will be used solely by Aspull surgery. And then at the front off the main waiting reception area will be a meeting stroke group room. And the idea there is that this space could have all sorts of different functions going on in there that will be maybe very different to what you would have found in any sort of doctor's surgery in the past. and that has the potential to connect quite easily to the reception area. At first floor, so the stairs and the lift are located in this position here, and then at first floor there are 4 further consulting suites that will be predominantly used by WWL, with a subweight area at the top of the stairs here. And then the other sort of key function of the building as well is that it's there to bring in people from different agencies. So there's an SDF base located within the staff area. All the areas sort of coloured blue are sort of staff areas. So that the idea being that different agencies can get together and can interact and can gain knowledge from each other with regard to particular areas of concern or opportunities, etc. So it's trying to have a much more joined up approach in terms of the way in which primary care is delivered. So these are some views of the building. So on the top left is a view from the green, from the roundabout end of the green. So in front of the building here, one of the ideas that we've had is that wouldn't it be great if we can connect more positively with the local environment? So the landscaping is key to that for us, and so one of the key features is this orchard that's been planned to go to the south of the building. So this has some quite positive benefits. The intention is that these trees would be deciduous, so in the summer the trees will be in full leaf and will offer some amount of shading to the building. But a key idea is that there's educational opportunities in terms of health benefits and healthy eating. I don't. Those of you who live in Aspull, there's a few of you mentioned you live in the area. You'll be aware that just across the road, to the left-hand side of the road here, are some allotments, and the idea was that there's an opportunity, if possible, to connect in with that as well. The image on the top right is an aerial view from the car park, so from the rear of the shops. So you can see the main entrance here and the rest of the car parking area. And hopefully you can see how we're trying to enhance this car park and bring lots of landscaping in there and to try and soften the whole thing and to create a much more pleasant environment in there. The view on the bottom left is looking along Hay Road towards the main entrance, which is here, and just in front of the building there you can see cycle shelters. There's some raised planters there as well, so the idea is that these might also be able to join in this idea of promotion of healthy eating and looking at how people can develop growing their own produce, etc. And can connect into that educational aspect of what we're trying to do. And then this is on the bottom right is just another view from the green looking towards the pharmacy. You can see in the bottom right here, and you can see the cut through going underneath the building in the centre there. And this slide just shows you a typical consulting room. So I did mention that it's quite early days in the process. So the views that you've just seen and these views are very much works in progress. But what I would like to do, if you do choose to have us back, is to start talking more, particularly to this group, about finishes and colours and how those feel in relation to the different spaces. So these views are all of a typical consulting room, and this is all about how the clinician, in this instance who sat at the end of the room, greets the patients when they arrive into that room, where they sit, where the examination area is, how that works, how the clinician deals with closing that curtain while still being able to wash their hands, and how the whole function of that room works. And these are just hot off the press at the moment, and we're just about to sit down over the next couple of weeks with both the surgery and WWL to start working through in much more detail about how these rooms work, such that they respond directly with how they want to work and operate these spaces. And then I'll just quickly go through the last few slides, and in lieu of being able to show you any detailed internal environment of the new building, I just thought that might be useful for you to see some of our thoughts, or the team's thoughts really, in terms of how these spaces might be. So the bottom left-hand slide isn't about us bringing cars into the main waiting area. It's about the whole change in perception about what a waiting area might be. So that, this is an idea about the space being one where you might be greeted by staff, or you, rather than just arriving up at a reception desk. And it's about the patients not being necessarily being treated just as patients, but as consumers, and there to be served, and how those people are served within that environment, and how that environment can be much more relaxed and positive and inviting and engaging for people entering that space. And the central image there is about bringing green into the building, if at all possible. Again, creating that healthy environment inside and trying to connect the outside to the inside. The right-hand image is an example where we've looked at those sorts of things in the past. And so these are all ideas that we're trying to bring into this building. On this slide, we're just talking about some of the early thoughts that we had, and we've talked about in the past with the practice about reducing inequalities, and about how, if we're clever about the way in which we set out chairs and colours and the spaces, it can be much more welcoming to people visiting the building. It can be much easier for people to be able to navigate the spaces, and it can be easier for clinicians, if they so wish, to be able to go more directly to patients to greet them, rather than the other way around. And we believe that colour has a big part to play, and we really do welcome your feedback in terms of signage, which is shown on the right-hand side, and how zones are coloured, and how we use palettes of colour in different areas to communicate which spaces people need to circulate to and where to circulate from. An area of interest to us, very much so, is in dementia design. We don't believe, or it's our sort of belief really, that in tackling and looking at proposing design solutions to solving current inequalities, there's no reason why that should prejudice anybody. And if it's done carefully and sensitively, we can make spaces better for everyone. And these images are just an example of studies that have been looked at by, in this instance, a flooring manufacturer, in terms of how people who don't have dementia can try to understand what people who do have dementia see certain spaces like. And by doing that, it helps us to create better environments. And this is the kind of tools, or these are the kinds of tools that we're going to be trying to employ to make this building better for everybody. And then these images just show some of the ideas in terms of what some of the spaces might be, both inside and outside of the primary care centre. And so it's just trying to demonstrate that it's not your typical primary care building. And these are some other ideas in terms of what those spaces might be as well. And then at the forefront of what's going on at the moment as well, there's lots of ideas in terms of self-diagnosis and preventative health solutions. And these are just two examples of that. I'm not saying that these are definitely going to be in this building, but what we can say definitely is that there will be the flexibility for the building in the future to house this type of facility if that is the way that things go. These images I've just put on there because going forward, what we would like to do is to take you inside a room and to show you in the virtual world around some of the spaces, including the waiting areas, including the treatment rooms, etc. And so at the moment, it's in an embryonic state, but we're just exploring the idea of being able to get disposable glasses that we can circulate to people, so that I'll be able to put an image on the screen and hopefully you'll be able to put yourself in the space and have a look around. So I can't promise for definite, but that's the kind of thing that we're looking at, to try and, the more we can help people understand what we're doing and what we're drawing, the more feedback we can get, because we fully understand that not everybody can understand two-dimensional drawings. So it's just trying to make things more accessible for people. And then the final thing I'd just like to mention is that this is going to be a really sustainable building, and all this slide is talking about is a standard that we're looking to achieve, which is called BREEAM Excellence. And I don't want to go into too much detail, but what I will say is that by looking to tackle these headlines shown on the right-hand side, we will create a building that far exceeds current regulatory standards. And in doing so, we'll make the building far more efficient to run for the surgery as well, which will in turn help them deliver even more services better for everybody. So in terms of the next steps, I've just put some sort of highlights there in terms of the design programme. We are now headed towards a planning application, looking at sometime in sort of late February, something like that. After that, we'll be looking to tender the project, so that will be going out to contractors to get a best value price to build the building. And then all being well, we'll be looking to appoint a main contractor to build that building in May, with a build commencing sometime in the summer there, and then looking towards practical completion, which is the finishing of the building in April 2022. So I've just listed on this slide how we think, these are just my initial thoughts, but this is not closed at all, of how people might be able to interact and respond to us, you know, access, colours, signage, amenities, the clarity of the spaces and the accessibility around those spaces are just a few key ideas that I had in the initial stages. But if anybody has any ideas or feedback, we would welcome that. So I think that concludes my presentation. Thank you.
Paul, thank you ever so much for that. I really do appreciate it. It's so refreshing that you come into our group